Welcome to the Zebra Crossing. Today we have with us Dr. Prashant Khaire, who has been practicing consulting homeopath for the last 25 years. He has an immense track record in handling both acute and chronic cases. He has also been a lecturer for 25 years at Lokmanya Homeopathic College. Welcome to the Zebra Crossing.
Hi, Janhvi.
First of all, could you tell us a little bit about yourself, your education, and your journey?
Okay. Yeah, myself, I'm Dr. Prashant Khaire. I did my BHMS, means in India we have got a course BHMS, that is a Bachelor of Homeopathic Medicine and Surgery. I passed out in 1996. I did my bachelor's degree from Lokmanya Homeopathic Medical College, Chinchwad. Then I did my post-graduation, that is MD in Homeopathic Mathura Medica in 2010 from the Kakasaheb Maske Homeopathic Medical College, Nagar. And I'm practicing a classical homeopathy as a homeopathic consultant for last 25 years in the Chinchwad area.
Okay. What exactly is homeopathy and how is it different from other forms of medicine?
Yeah. See, basically there are three main streams in India in a medical practice. That is the common thing that everybody, you go to allopathy, that is the MBBS, or that's the routine medicines, injections we took. The other two lines they called as alternative systems of medicine. Basically the three other lines, that is one is a Ayurvedic system of practicing. The degree is called as a BAMS. The second, the homeopathic system of medicine, this is called as the BHMS. And there's one more system, that is a Unani system, where the degree is BUMS.
Okay.
So there are some differences between the allopathy and homeopathy. So what a basic difference we'll say, suppose the diagnosis part will remain same. Suppose there are patients, a patient who is suffering from, you take appendicitis, acute appendicitis, the appendix infection. So the patient comes to a doctor, he's having a pain in the abdomen, having a vomiting, having a fever. The doctor will check the patient. Doctor will do the certain investigations and he will diagnose it as an acute appendicitis. Till this part, all the systems are same. But when it comes in a treatment pattern, so allopathic doctor might advise you to go for a surgery, or homeopathic doctor will treat according to their system, that the system which is based on certain fixed principle. So other than the diagnosis, for allopathic doctor, the diagnosis is the only thing with the investigative form, and they will give a treatment. And for a homeopath, then our medicines line will be different. So allopathy, there will be antibiotics and other painkillers, and a surgery will be the treatment, and our medicines will be different. And what we say in homeopathy, that we treat the man in disease, not the disease in man.
Okay.
So other than the symptoms which are there for diagnosis, we see certain other symptoms that belongs to that patient. And then we form a totality and we prescribe our remedy. So our system is a little bit different, which is based on a certain principles, which is called as a holistic system, which considers the mind and body together. We form a totality, form a portrait, and we matches that portrait of a patient with a portrait that has been listed in our Mathura Medica, that is our medicines. We match it and then we prescribe it.
Okay. Homeopathy has been with us since the last 18th century. How has it changed? Because the economy has changed, the lifestyle has changed, the people has changed. So how has this field of medicine evolved with time?
See, the homeopathy, which was discovered in the late 1800s by Dr. Samuel Hahnemann, who himself was an allopath. During that particular period, the allopathy was not named as allopathy, it was called as the old school of medicine. And during that particular era, the allopathy was like a little bit like an infant, you can say a toddler. Where in today's allopathy, or today we call it as a modern medicine system, where there are lots of diagnostic tools, investigative tools are there, good surgical procedures has been developed, a lot of new medications has come, like antibiotics, painkiller, different kind of medicines are there, which was not there in the 1800 era.
Okay.
And Dr. Hahnemann, who was allopath himself, who was unsatisfied with the medication or the treatment they were giving in that particular era, and that's the reason he was searching, he was doing a lot of studies, and he discovered the homeopathy. So homeopathy during 800 era was a very good system of medicine, a gentle system of medicine of the curing. In that particular era, there was a bloodletting and some painful treatments were there in allopathy. To compare to that, homeopathy was a very simple, sweet pills were there. So it was a gentle medicine which was not giving many troubles to the patient. But as the years passed by, the lot of development has happened in a modern medicine. So in that particular era, there were many the infective diseases were prevalent, like tuberculosis. There were epidemics of the cholera, the epidemics of scarlet fever. Most of the viral and bacterial infections were there a lot in that particular era. But as the invent of antibiotics, those diseases came down drastically. But in today's modern era, now the lifestyle has changed. More luxurious life is there. People are not giving much importance to the physical fitness. They are not taking the proper sleep. They are not having a proper diet. A lot of mental stress has been there. The time management has changed. The sleep pattern has changed. The food habits has been changed, and that's the reason even the disease pattern has been changed.
Okay.
So in the 18,000 era, there were many infective diseases were there. But if you see in today's era, like suppose young girls of your age, a lot of young girls are becoming very obese. They are developing the pathologies like a PCOD, polycystic ovarian disease, or a lot of young females are developing a hypothyroidism, or hormonal diseases are increasing a lot. Like you see a diabetes mellitus, a lot of cases are there. India is a hub of diabetes. A lot of hypertension patients are increasing. Hypercholesteremia cases are increasing. And even in a post-COVID era, or due to a lot of use of chemicals that is happening in everywhere in the world, like you take for farming, they're using a lot of chemicals. You see any fruit that has the chemicals has been used. You take milk for that matter. Many people use sometimes oxytocin injections to that the cows and buffalo should give you more milk. So the use of too many chemicals and this kind of hormones, they are causing a lot of damage, and we are getting these hormonal disturbances. We are getting a lot of autoimmune diseases, like you see many cases of psoriasis, rheumatoid arthritis, SLEs. So those kind of diseases are increasing a lot. And the one more thing that I'm observing for last 4-5 years, even the cancer cases are really increasing in a drastic way. So these are all these disease patterns are changing because of this modern lifestyle changes. Too much use of chemicals, too much use of non-scientific way of medications are there. So these things are killing the people nowadays. And so homeopathy could be very useful in such a cases, because we are not dealing just with the disease, we are dealing with the patient. In a simple language, I will tell you. Suppose you get a hypothyroidism. What you'll say? I am having hypothyroidism, that's why I'm ill. But as a homeopath, what I will say? You are ill, and that is the reason you are getting a hypothyroidism. So this is what we do in homeopathy. We treat the man in disease. Suppose there are 3 patients of a hypothyroidism comes to us. If you go, this 3 patient goes to a allopathic doctor, they will prescribe the same medicine. Depending on the levels of the TSH, their doses will be different. But for me, all these 3 cases will be different. I will go to the root cause of that disease. Why this patient suffered from a hypothyroidism? What is the cause? And when I will take my history, in homeopathy, we give a lot of time in our history taking, which is the most important thing in our practice. That we go to the root cause and we try to analyze why this lady suffered from the hypothyroidism. And then we see the causes. And the causes there, they are usually the 2-fold or 3-fold causes. First is the mental thing. Like we will ask that, Baba, any mental disorders were there, any stress was there, anything happened in your life, whether it's a short or long-term grief was there. And after that particular incident, that your body had changed, and then you suffered from the hypothyroidism. Allopaths will never give importance to the mental cause. But we believe in a holistic health. Mind and body should go hand in hand. So body is important. The disease pattern is important, but at the same time, the mental health, which is also very important in today's era, there, as a homeopath, I think we can have a lot of role, because we give a lot of importance to the mental health of the patient. We go to the deeper cause of the mind, and we take his mentals in a detailed way, and then we can help the patient. So our medicines will be different for the 3 individuals who are suffering from the same disease. That's the difference between homeopathy and allopathy. Where we consider both the things. Allopathy will only consider the end product of the disease, and they will just treat that particular disease. So they treat the disease. But as a homeopath, we treat the man in that particular disease. Okay?
Wow. What are some of the principles that homeopathy is based on?
So basically, we call it as the 7 cardinal principles. But for most of the common people, I think the 2 principles we should highlight. One, our basic principle is similia similibus curantur, or the like cures like.
Okay.
This is what we follow in our practice. Like suppose a certain thing which can produce some symptoms in a healthy human being, then that thing can cure the symptoms in a diseased individual. Means, for giving you example, like how the homeopathy was invented, I will just tell you in short. So Dr. Hahnemann, who was translating some literature, and there he came an article that there is a plant called as a Cinchona officinalis. The bark of this particular plant, when was consumed, was producing symptoms which were similar to malaria.
Okay.
And he got the idea that if this plant is given in a healthy human being, is producing the symptoms like malaria, why can't we use this plant in the treatment of malarial patient? And he do some investigations, he do some things, and he gives that plant to certain malarial patient, and to his surprise he found some good result in the malarial patient. And there first the idea came.
Okay.
So thing which can produce a disease like symptom in a healthy human being, so the same material if you use in a diseased individuals can cure that particular individual, and this is we call as a like cures like.
Okay.
And the second important principle you people should know, the law of minimum dose that we follow. Because you see in most of the allopathic medications, there are the tablets given in a certain milligram. There are a lot of doses are there, which is they are giving 2 times a day, 3 times a day. Because the basic way, the allopathic way of treatment is that what? The action of the medicine should cause the disappearance of the symptom. So suppose the fever comes to a patient, you should give a paracetamol 500 mg depending on the weight of the patient 2 or 3 times. So after the action of the paracetamol, the fever should come down. So that is the action of the medicine which is causing the cure. But in a homeopathy, what we do, we are law of minimum dose. We don't want to bombard the patient with the repeated doses of the medicine.
Okay.
What our system will do, we use a very minimum quantity of the medicine, and our system based that the cure should not by the action of the medicine, it by the reaction of the body is there. So suppose the patient comes to us a constipation, we will give us such a medicine in a small quantity that should produce the constipation only, the like cures like. So that, but after giving my medicine, once the action of that medicine, because the dose is very minimum, then the body will definitely react, and body will react in opposite way. So the constipation will get reverted and the patient will get a normal stool.
Okay.
So that's why we are just stimulating the immune system of an individual by a minimum dose, where we don't have to bombard the patient with literally lot of milligrams or grams of the medicines. A minimum quantity is required to stimulate the immune system of the patient, and then the patient will cure itself on his own. Medicine will only stimulate. That's the fundamental difference between the homeopathy and allopathic line of treatment.
How is the practice of consulting homeopathy regulated and integrated in India?
Okay. So in India, there are different states. Every state has been governed by their state body of homeopathy. Like for example, I am practicing in a Maharashtra. So Maharashtra has been governed by Maharashtra Council of Homeopathy, MCH.
Okay.
And there is every college comes under one university. And in Maharashtra, there is a MUHS, Maharashtra University of Health Sciences, which is there in Nasik, which governs all the medical colleges, including the MBBS, BAMS, and the BUMS also.
Okay.
So these are Maharashtra. And then this state body that has been governed by one center body that is called as NCH, National Commission of Homeopathy, which is situated in Delhi. And this National Commission of Homeopathy, NCH, that comes under the Ayush department of a central government.
Okay.
So the mainstream is Ayush, which governs the NCH, and the NCH governs the MCH and MUHS, and all the colleges run under the domain of this particular thing. And they give us one degree, they give us a register number, this is your permanent registration number, and only the registered medical practitioner is allowed to practice in the Maharashtra and all over the India. Okay, this is the way the system runs in the India.
Okay. So while researching, I came across some misconceptions like homeopathy is a herbal science and that the doctors don't use diagnostic tools. How do you address these misconceptions?
Okay, yeah. The first misconception, this is really misconception that homeopathy is only herbal science. That's not true. See, if you see homeopathic medicine, there are more than 3,000 plus homeopathic medicines are there. And these medicines are prepared from the different sources only. Meaning, in our first year of our curriculum, BHMS, there's a Bachelor of Homeopathic Medicine and Surgery. There's one subject called as a pharmacy, where all the students learn how the homeopathic medicines has been prepared. And so there are many sources, namely it's not just a herbal. Yes, there are many medicines which are prepared from the plants, the different parts of the plant. There's the one source, but there are multiple sources, like some animal sources. The
Okay.
homeopathic medicines are prepared from the poisons. They are prepared from certain snake poisons, certain insects poison, certain mammals, certain milks of the mammal. That's also one of the source. Then homeopathic medicines are prepared from the chemicals also, like certain minerals, very common minerals, like suppose the common salt. There's one classic natrimur is our best medicine. Then this is medicines prepared from the salt. Then the medicines which are prepared from the metals like gold, platinum, silver. Even from those substances we prepare the medicines. We prepare the medicines from the lead. So there is a animal source, there is a mineral source, there is a metal source, there is a plants are there. Then even certain medicines are prepared from the disease products, like that we call as a no sod. Like suppose the
Okay.
disease product has been taken, that particular preparation is taken in a minimum quantity, and we call the procedure is there a triturate, and we prepare medicine that's called as a no sod. We prepare medicine from certain healthy parts of the body. They are the healthy secretions of the body. They are called as a sarcodes. We prepare medicines from imponderabilia, from means the moonlight and all those kind of things. Also, we prepare our medicine. So it's not true that it's only a herbal medicine. We prepare medicines from different sources. That could be the animal products, that could be the animal poisons, they could be minerals, they could be metals, they could be inert subjects. They we take, we triturate, and the power is aroused.
Okay.
So it's a misconception that homeopathy is only herbal. It's from a different sources are there. And what second misconception you said?
The diagnostic tools, that doctors don't use diagnostic tools.
That is a big misconception, I feel. Means, yeah, I come across many things that homeopaths, they never check the patient, they never take the blood pressure, or homeopath never do the investigation. That's not correct.
Okay.
See, we're also having a degree, Bachelor of Homeopathic Medicine and Surgery, and I'm a postgraduate MD. So we have to, in our college days, we have to go to the clinics, we have to work in ICUs, we have to read the investigations, we have to report to our seniors. So we do everything, all the things that MBBS graduate do, the same things we are doing in our college days. And even in our clinics, it's a misconception. We check the patient, means whoever a homeopath or any doctor who is first clinician. This is what I'm trying to tell. Suppose a patient comes to my clinic. I'm just giving one example, a small example. If any patient comes to my clinic with a left-sided chest pain, simple. So what my duty is to first diagnose why the left-sided chest pain is there. I will ask the requisite questions. I will check the pulse of that particular patient. I will check the blood pressure of that particular patient. I will auscultate, I will palpate, I will do everything. And if I find that no, this patient, if the pain looks to be a cardiac pain, I will not just say that you take my medicine and go home. I will send the patient to do the ECG. I will send the patient to do a requisite lab investigations. And if I find that this patient is suffering from some grave disease, that he is going in a heart attack, he's having some ECG changes are there, some the lab changes are there, I cannot just say you just take my medicine and go home. I have to admit the patient in the ICU. So that's a misconception that the homeopaths don't check the patient. Every homeopath is a clinician first. So he requires everything. Homeopath has been taught the clinical subjects. Along with the clinical subject, we have to learn our homeopathic subject.
Okay.
So till a diagnosis part, the MBBS and homeopathic doctor is same. Both do the same thing. Both do the same investigation. Only the latter part will be different. The mode of the treatment will be different. The allopathic way of treatment is different, and the homeopathic way of treatment is different. And little bit the case taking part will be different after that. So allopath only diagnose the disease and they will treat the disease. Homeopath, we have to diagnose the disease as well as we have to diagnose the patient, which I was talking about previously, that we treat the man in disease. So our part is little bit tedious than the allopathy.
Okay.
But yeah, we have to do all the investigations and we have to diagnose the patient also. So we are a good clinicians also. We require all the investigation that is available in the modern medicine today, and we are allowed to do all these things.
Okay.
Okay.
Coming back from homeopathy to yourself, Why did you take up homeopathy as a career, and how do you envision contributing to the field?
Yeah, good question. So when I passed in 1996, 97, initially as I started my career, in most of the cases in India, there are very few people who directly go and practice homeopathy, very few percent. Most of the people, they first go and do the general practice, we call it is India. That is a allopathic mode of practice.
Okay.
90% homeopathic doctors do the same things. Even I started my career as a allopathic doctor who was prescribing the allopathic medicines in initial few years. But when I was practicing, I was very interested in homeopathy, but I was not having enough knowledge, or I was not having any confidence to practice homeopathy. But when I was practicing allopathy, when I see many kids, they used to come to my clinic. Means they used to suffer from a viral infection, upper respiratory infection. I used to give some antibiotics. Again, the patient used to come after few days with the same disease, with the same pattern. And after every month, I see many patients, they're coming with same complaints again and again and again. With allopathy, I could not able to eradicate that disease.
Okay.
Only I was used to some palliate for a temporary being, or just temporary treatment used to be given, and the patient again used to come back with the same complaints. Then I was a little bit frustrated what I'm doing. I'm just giving a simple medicines and the patients are again coming back. And as a homeopathic graduate, I was no, homeopathy can treat from the root. Homeopathy eradicate the tendencies. Homeopathy eradicate the disease from its, annihilate the disease from the root, and homeopathy can cure such a diseases. Allopathy can only palliate or temporarily relieve those diseases.
Okay.
And then I decided, no, it's enough of the allopathy practice. I can only handle this respiratory cases or the loose motions and diarrheas. I'm not able to handle, I'm not able to cure the patient. And I changed my mind. I started studying more homeopathy, and after 2003-4, I stopped all my allopathic practice and I became a pure consulting homeopath. And then yes, for last 20-25 years I am practicing, and last 20 years of pure homeopathy I am doing. I'm getting good results with my medicines now, and I'm happy that I'm, as a homeopath, I'm not practicing allopathy now, because I can see the results in my patients, and I'm very happy.
Wow. What are some of the challenges you faced, and how did you overcome them?
The challenges, there are many challenges. First of all, when I started my career as a homeopath, initially homeopathy was practicing only in some elite class, means only the educated class or the people having a lot of money, they were only taking the homeopathic medicine when I started my career. Very few people I used to see, means coming from a low middle class or low socio-economic cases, they were very few. And our system of medicine is such that we need information from the patient. We just
Okay.
can't rely only on the disease pattern that I can get, from the investigation. But as I said, suppose a chronic case comes to you, that a PCOD, we used to ask the patient how the disease started, what are the mental things, what were the mental causes, and we require the detail in a lot, information in a lot of detail. And some patients, they never used to understand why the doctor is asking all this thing. I am suffering from a joint pain. The patient used to complain, doctor, I am having a joint pain. Why you are asking my nature, how I am? Why you are asking what food items are like? Why you are asking what kind of perspiration I am having? Yeah, treat my joint pains only. Why you want to ask such a detailed things? So they were not able to understand what questions why the questions we are framing, what information we want. So that was the first challenge, to convince the patient, because the allopathy is there in everybody's blood in India, and to convince them how the homeopathy is different from allopathy is the first challenge, to get the information from patient only. That was the first biggest challenge, especially patients who were not educated, who were from a low socioeconomic status. They was very difficult to convince them. That was the first challenge. Second challenge, again, sometimes, suppose a couple comes to your clinic. A husband was not believing on homeopathy and the wife was believing on homeopathy. Then it becomes again a second challenge. But convincing thing is the most important challenge, which I found in my initial practice, to convince the patient why we are asking so many questions, why we are taking history in such a detail. That was the first part.
Okay.
That was the major challenge which I found in my initial days. Now there are many patients. Now I didn't get such a challenges, because now I am an established person. But initially, why you require homeopathy, that was the thing. Suppose the patient recurrently coming for the same complaints again and again, then I have to convince him, boss, you're getting this problem again and again. There is no treatment in the allopathy for this. Allopathy is a good science. It's a good science for the emergencies. If a surgery part is there, it's a good science, but in certain chronic cases, allopathy won't work. Or sometimes only immunosuppressive therapies has been given, so they will cause a lot of side effects. Here we are having role, but you have to give us a proper information. So convincing the patient, turning the patient from allopathy to homeopath was the biggest challenge which I faced in my initial days.
Okay.
Okay.
That's all the questions I had for you today. Do you have any final thoughts or key takeaways you would like to add?
Yeah, what I will just say, homeopathy is a very beautiful science. Many people doesn't know much about the homeopathy. With due respect, allopathy is the first line of treatment in many cases, but still there are many cases like the autoimmune disease, a chronic in medicine part. Allopathy is not having much to offer.
Okay.
Allopathy has got a good role in a surgical part, where allopathy definitely scores over any other system. But in a chronic medicine cases, I personally feel homeopathy should be thought of, or homeopath and allopath should work together. There should be a holistic system of medicine which will help the mankind. From my point of view, the patient's life is first, then the pathy will come. So
Okay.
let the patient decide what is good for him. And homeopathy, given in the initial stages, definitely very beneficial in certain diseases which I was talking about in the modern lifestyle diseases or autoimmune diseases, where homeopathy will have definitely had got a good role. Or homeopathy will build the immune system, or homeopathy sometimes will build your thinking, your thought process. At the mental level, homeopathy works, that builds the confidence of the patient. So these things are also done from the with the help of the homeopathy, and we should promote homeopathy in more and more cases, and even the allopath should back us in certain cases, and we should work hand in hand together to serve the mankind. That's what I will say with homeopath can do.
Thank you
Thank
so
you.
much for your time today, Doctor. It was delightful talking to you.
Thank you very much, Janhvi.
Thank you to our audience for tuning in today. Do like and subscribe and leave a comment on what else you would like me to talk about. Thank you.